Time now 12:42, and it is time for your midday prescription. We continue our conversation on COVID-19 with WDSU medical editor Dr. Corey Aber. As always, good to have you in studio, Doc. Appreciate you and your time.
Me too, me too.
Couple things we want to talk about today. Hospitalizations for the first time yesterday dropped below 1,000. What does that indicate here?
It means that about 2 weeks ago, we started doing what we were supposed to do, and that's really important. We kept our distance, we've eaten well, we've gotten some sleep, we've boosted our immune systems, we kept our masks on, so I'm very proud of you. I mean, we are getting the numbers down. That's what happened 2 weeks ago. So since we have reopened now, however, then we need to start looking at our numbers 2 weeks from now, because those are the numbers that are going to show us exactly what's happening now, meaning we're interacting, we're breaking our pods, we're having dinner, we're having drinks, all these types of things. That won't be able to be seen. The outcome of that won't be able to be seen until about 2 or 3 weeks, sometimes even 4 weeks. So let's just remember, let's stay true to the course right now, do what we need to do. And I know, even though it's so easy to want to just go to a restaurant right now and sit down with people and have a few drinks, just remember, the more you drink, the more your inhibitions go down and the closer you get. And you start thinking like it doesn't really matter, and it really does. So just remember that we're a town that likes to have fun, so just be careful, definitely careful now.
Dr. Aber, over the past few weeks, really, we've seen more testing going up. And in Mid-City, they're doing testing today, but they're switching from the nasal swabs and they're doing oral testing instead. Yes. What may have caused that shift or that change in testing there?
Well, a couple of things. A lot of companies are making tests that are much more rapid so you can get the results quicker, and that's important. And then that one that used to tickle your brain, that one was not very comfortable. So people don't want to do that test. They find that it hurts, and it's not really something that if you had a choice you would do. So they're switching to some antibody testing, which we're waiting to see which ones are most accurate, and we're waiting to see, and we're also switching to some of the antigen testing that comes back really quickly that can be done by oral swab, and some even by blood. So it's important that we realize that there's going to be lots of different testing modalities out there. You just need to do one if you start having symptoms, if you are a person that works in a hospital, if you're in a nursing home, or if you work at a nursing home. Those are the people that really need testing. But everyone theoretically needs a test at some point to see where they are in the paradigm. And also contact tracing, it's coming. I want you to be used to it, and please don't be scared. You get traced by the things you buy on Facebook. You get traced by your cell phone. It is nothing new and exciting. You get tested and traced for all types of things. So just when they call you for that, don't act like you don't know what's coming. Just be careful and understand that you're going to need to get the contact tracing done.
You Google one thing, you see it pop up everywhere on your phone. Lastly, Dr. Aber, in regards to testing, these locations are now allowing people as young as 10 years old to get tested. Originally, we would see you have to be at least 18. Right. Why now 10? Yeah,
well, 10 because now we see that the kids are super spreaders. We know that they are spreading it to their classmates and to their older family members and to their younger family members. And we started seeing an increase in this post-COVID infection type syndrome with the toxic shock and the Kawasaki-like syndrome. So what we wanted to do is just make sure that we do have the data points to see that if we start seeing an increase in children's infections and children's deaths, then we'll have just a basis at least for us to start looking at some contact tracing on those kids that were infected. So be ready that as school starts, there's going to be a lot more testing, because we want to make sure that we can contact trace anyone, regardless of their age, to make sure that their group and their pod is safe and healthy.
All right, WDSU medical editor Dr. Corey Aber, as always, we appreciate your time. If you have any questions for him, you can email askdraber@wdsu.com. Thank you so much.
Thank you.